Away we go. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Here today with a hero, police officer who got injured in the line of duty, and our paths crossed, and we've been working together and trying to get him better. But some really interesting stuff to talk about today, and we're going to focus on chronic pain and some solutions for chronic pain. Just because one doctor says you have no hope, that doesn't always mean that's the case. So we are going to cut to break, and we'll be right back.
Okay. You all right?
Sure. Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. And I'm here today with a hero. He's a police officer, and a lot of us take our police officers for granted. If they only knew half the stories, we at Buckeye, we treat a lot of police officers, and some of the stories I hear are just crazy. These guys literally go through hell on a daily basis to make us safe, so we appreciate it, and we try to take care of them too. But I'm here today with Pat. What's going on, Pat?
Well, I was shot in the line of duty back in March. Suffered a nerve injury as a result of being shot, and unfortunately, the bullet struck a bundle of nerves in my upper leg.
You got shot like in the butt, right, or something? Or like
it hit the hip.
Mm-hmm.
And
because when you guys go in, like, you're fully armored up, right? Like,
yeah, my job was based with an entry team that we basically execute narcotic search warrants. So we wear the big heavy entry vest, a lot of additional equipment and gear, helmets, a lot of extra safety gear that you don't normally see.
how often do you guys get shot at?
It happens occasionally.
Yeah, I think that's no big deal. Like, I mean, how long were you?
No, that's a big deal. Yeah, nobody likes getting shot at. We've been very fortunate for a while. We have had some incidents in the past. We've got a couple guys on our unit that have been shot, and they've managed to recover and still come in and do the job every day.
Yeah. What makes you get into that? Like, how do you? You always an adrenaline junkie, or you always? It's not normal to want to go into a situation.
No, it's never been about being an adrenaline junkie. It's more progression about doing the job. Right now,
Were you military?
No.
Okay,
no military background.
Okay.
Being a police officer is something you
Yeah. What
really
point in your life did you want to be a police officer? Were you a kid and like playing with toy guns, or like?
I grew up with my uncle was chief of police in the town I grew up in, and my dad was a police officer.
Okay, cool.
So it's something that I thought of often.
So even a kid, like, hey, my dad's doing my. Okay, cool. So
yeah, always around it.
Okay, very cool. And then you sign up and you do it, and then, obviously, there's a police officer, but then there's SWAT's like a whole other animal.
Yeah, it's a whole nother thing. The SWAT guys, they have a very difficult job. They do their mission is a little bit different. They handle a lot of hostage barricade. They a lot more training than a normal police officer gets. They have to maintain a physical fitness regimen. They have to maintain a certain.
And not everyone can be SWAT. You have to qualify.
No, there are very few people that actually would fit into that category. SWAT's different than what I do.
Okay.
So, a lot of respect for those guys. A lot of people don't understand how difficult their job is and what they have to do to just maintain that.
Gotcha.
And our unit's very similar. A lot of specialized training, and it's a difficult job that is, again, it's not for everybody.
Gotcha. So how long were you in the position? You were doing it for?
I've worked narcotics for about 17 years.
Wow. It's a huge problem too, and it's not getting any better. I mean.
Yeah. I've been over on that unit for 4 or 5 years.
Wow. So then, so basically, this day you were just executing a
narcotic search warrant. Right now, it's the same thing we're seeing every day. The heroin, out trying to take care of these locations in the neighborhoods that are selling the drugs. It's something that it helps the neighborhood. You have this problem in the neighborhood where you have a house that they're dealing out of. We get that information and basically execute narcotic search warrant and try to lock up the guys that are doing that.
And I think a lot of people, the general public, we're all pretty sheltered. I live in a decent neighborhood. Like, how many of these things go down? In Columbus, would you say how many go down a month? Would you say there's like
Our unit was executing roughly about 300 narcotic search warrants a year.
So almost every day, you're going to a house that deals narcotics.
Yeah.
And it doesn't stop.
No, it's every day. I think the day I got shot, I think that was our third mission of the day.
And I think people don't understand that because we live in our homes and, you don't realize that every day in Columbus, and this is, it's not just a problem in Columbus, it's probably every major city in the country.
Every major city, every small town. Right now, it's, there's no place that you're not going to find it. Even the small towns are being inundated with it. And, we do our best to try to do what we can to put a stop to it. Anything we can do to try to slow that down or stop it is what they're trying to do.
Dang, it's crazy. So anyway, so this day you're doing, just another day in the office for you. You go with your team. There's a bunch of guys you go in with, and that's when everything went wrong.
Yeah. It was my day to go through the door first. My day to run one.
You guys, is that round robin, by the way, or?
No, it's certain people run certain positions. It does rotate. They try to keep it even. There are certain positions where you're putting yourself in a lot more risk than other positions, and you try to kind of even that out. The guys on the team,
you guys are all brothers, so
yeah, you're there to work. You're not there to worry about stuff like that. You're there to work. So there's a general rotation, and that was just my day to run one. So it unfortunately, I fired a couple rounds. Fortunately, my vest stopped one round, and the other round just happened to hit me in the hip.
And then, and I asked you earlier. I mean, I'm a lay person here. When you get shot, that's probably a stupid question. Does it hurt? I watch too many movies, I guess.
Yeah, it hurts. It's not like Die Hard where your guy gets hit in the shoulder and then he goes doing pull-ups. It's debilitating and it's painful.
So I think the analogy you said, it's kind of like if you take a baseball bat and hit a metal pole, it just reverberated through your body.
Yeah, that impact of a round hitting the bone just sends that shock wave through your whole body, and you definitely feel it.
Wow. So then I imagine you went right to the hospital, and they let's talk kind of what happened at that point.
I got to tell you, we're so fortunate. We're in a different position in Columbus than other places. We've got what they call tactical medics, TEMS units. And these medics work directly with us.
So they're with you on.
So they're outside. They're not coming in the house during the entry.
Wow, I didn't know that.
But they're right there. So when something like this happens, they are on the spot within seconds. You receive medical treatment, and that counts. I mean, we've had incidents where other people have been shot, and without these medics, we wouldn't be able to do our job.
So as soon as it's secured, those guys are on you, helping you out.
Right now.
Wow.
Yeah. And so we're very fortunate to have that. And the medics are there, and they bring in the transport medic and straight to the hospital. So that instant care is so important.
Yeah, it's the difference between life and death. I'm sure,
and these guys do just an absolutely amazing job.
Yeah, I didn't even know that was an option. So then they took you to the hospital, and you said you got shot in the chest, I think, but the bullet, the vest caught that one, right?
Yeah.
And then, but the one that penetrated in like the gluteal or the butt area, and surgery, no surgery, I think.
Yeah, I've had 2 surgeries. First one went in to remove some shrapnel. The second one, they had to go in and remove the round.
Because you had mentioned to me earlier that you had this injury, and at first they weren't sure if it had hit the nerve or not. They thought it was just from the sheer impact or the shock wave of it was why because what was your initial symptoms, other than obviously the pain of the bullet you had?
Basically nerve type injury where you have loss of feeling, loss of motion.
In the leg.
In the leg. Mm-hmm. And of course pain goes along with that nerve type pain. Being shot in the hip, and then the pain is located in my foot or lower leg. Mm-hmm. So they know that that's a nerve type injury. There are different types. They felt that this was a blast type injury where the nerve wasn't directly impacted, but that shock wave had injured
the concussion of the bullet caused.
The bullet basically bruises the nerve and injures it. and it takes time for that to heal.
Mm-hmm.
So nerves heal very slowly. So they initially thought that was going to heal up.
So your prognosis initially at the hospital is, hey, listen, you're lucky, it didn't hit the nerve.
Things were looking good.
Yeah.
Things were looking good. Progressing 2 months down the road, I wasn't getting better. Things were actually deteriorating. It was getting worse. The pain was worse.
The pain in the leg you're talking about?
Yes.
In the foot?
In the foot and leg.
Mm-hmm.
So really no pain up in the hip area where the round hit me.
Mm-hmm.
Very little pain associated with that. So they decided to go ahead and remove the round. When they got in there to remove that, they found that it wasn't close or next to that nerve, aggravating it or rubbing up against it, putting pressure. It had actually struck the nerve. It took a direct hit.
Wow. And for people that don't know, in your butt area, you have what they call the lumbar plexus there. It's a big bundle of nerves,
Yeah.
so they control the whole lower extremity. So what might seem like a benign area to get shot is actually one of the worst areas to get shot, just because all the function to the lower extremity, all that the electrical system per se runs right through that area where you took the round.
Correct. Yeah.
So they went back in, they took the round out, thinking that would help it, and then what did they say after surgery? They came in and said,
unfortunately, that bundle of nerves did take a direct hit, causing more injury than what was initially thought. And unfortunately, some of those nerves are severed, and nerves that are damaged and severed in that way, they can't put them back together. When something's injured like that, it's the way my doctor put it initially was, if we could fix that, we wouldn't see people in wheelchairs today. They'd be able to repair those spinal injuries that you see in car accidents or gunshots, things like that.
right.
So, with that being partially severed, I am going to have a certain amount of permanent injury.
That's what they say right after surgery. They say, listen, unfortunately, this is the new you.
Yep. Get used to it. This is your new normal.
Wow. And what did they do as far as, what were you doing for treatment at that point then?
At that point, it's unfortunately, you're just down to trying to mask the pain with some medications. With nerves, opiates work differently. They don't do a lot. You see medications like Lyrica, gabapentin, Neurontin, those things that you normally see for neuropathy, and they're designed strictly for nerve pain.
Right.
So you have to treat with those type of medications, and you're just going to mask the pain and medicate it.
So basically, they said pretty much you're going to have to deal with the pain. We'll give you pain medication to mask it, and that's. Was there any hope of getting better? Like, did they say this will get better with time, or?
No, there was some initial. Again, the nerves that were damaged, we know that those are going to heal up. They very slowly, about an inch per month, something like that. Mm-hmm. So. There's still some time for some of that to heal up, but unfortunately, the ones that are severed, no, that's just the way it is.
Right. And I think that's when you called me. I remember you called me. I don't know if you remember the phone call.
Yeah.
I didn't know who you were. You're like, hey, this is Pat. I told give you a call, see if you could help out. And I don't know if you remember this, but you asked me at that point. That if we couldn't get it better, was it optional to get your foot amputated?
Yeah.
Your pain was that bad that you this burning foot pain, even though you weren't shot in the foot, that this may be a possibility to help you because you didn't think you could live with the pain that you had in your foot at that point.
Yeah, the amount of pain is just absolutely overwhelming. And dealing with pain like that over a period of time, it just wears you down. And I'm not a person that sits around.
Yeah, but we're on radio. People can't see you. Like you're a healthy guy. You work out. So it's not like you're a couch potato. Like
very active.
Mm-hmm.
I don't sit and watch TV. I'm not a guy that sits around. I'm always up and out doing something. Mm-hmm. And I enjoy the outdoors. And what I found is I really couldn't do anything like that. Mm-hmm. Very limited to what I can do. Can't walk more than 100 feet at that point, I think. And that's per day. I get up and go to the mailbox, come back to the house. The amount of pain I'm in at that point, it doesn't go away.
So what was it? Just your foot was burning, or what were you?
Just excruciating pain. More of a crushing feeling. There's some burning, but more of a crushing feeling.
Wow.
just absolutely miserable. So I couldn't walk on it. And my thought was at that point, and I even talked to a couple doctors who suggested it, that it's possible to amputate the foot, but they weren't certain about how the nerves would react to that. And my thoughts were, I don't care. I put a stick, I'll walk on it. I don't care. As long I get rid of that pain, and I can do anything. But that pain just wears you down.
Right. And I remember talking on the phone, and at that point, I didn't know the magnitude of your injuries or if we'd be able to help. But I knew it was worth a look, right? And sometimes it's good to get a second opinion because it seemed like the option that you had wasn't a really good one. There was really the option you had is it is what it is.
It is what it is, and just deal with it.
And so you came in, and we actually need to cut the break real quick, but we'll come back and we'll talk about some of the stuff we're doing with you and some of the results you've been getting, and hope to get you back to 100% at some point, right?
Yep.
We're working on it. So this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. We'll be right back. Sorry, it's cool.
No, good.
Yeah, we only got about 10 more minutes. Lean a little bit closer to the microphone if you can.
Okay.
Thanks. Appreciate it. All right. Ready?
I'm ready. Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. Buckeye PMR is the website. I'm here with Pat, and we are just talking about, I got here, Pat actually gave me a call. I'm not sure how you got my cell phone number, but it was cool. Anyways, and he told me about his situation, and at that point there, I'll be honest with you, we had just got a new toy. When I say a toy, it was a medical tool. We had just got a class 4 laser, and it's really good at treating nerve type pain. I didn't know if it'd be able to help you, but I was like, what the hell do we have to lose?
Yeah. I actually had a buddy that was talking to you someplace, knows you, a mutual friend somewhere, and had talked to you, and he said, man, you got to call this guy. I think he'll be able to help you. And I put it off. I kind of didn't think that would happen. So eventually I called, and that's when I got a hold of you. And yeah, the laser is it's kind of changed everything.
Yeah, and just so people know what it is, so it's a class 4 laser, which is different. It's not like a laser pointer, or there's a lot of low power laser out there. This is it's a really strong device, which you need for the penetration. But what happens with nerves and damaged tissue like you have is, number one, your pain's in your foot, but that's not really the problem. So we started treating up where the bullet went in, where there was no pain,
where the injury to the nerve occurred.
Yeah. So and what that class 4 laser does is a process called photobiosynthesis, and basically what happens is nerves in general don't heal well, right? So when they become damaged, there's a lot of them that just don't heal at all, or they heal very, very slow. When you use class 4 laser on that, number one, you have the power to penetrate. It's a 60-watt laser. But what it does through this photobiosynthesis is it stimulates the cells and speeds up cell metabolism, which makes things just happen faster. So it's basically supercharges healing. So it's kind of like if you had a flower and you wanted it to grow, if you put it in the sun, it's going to grow faster. The same process happens with your nerves. I think we experiment, I told you I couldn't promise you anything, but I knew it was worth a shot.
It was definitely worth a try. Nothing to lose.
I think you were my first, you and my dog were the first people that did the laser.
Yeah.
You guys are the guinea pigs.
It's been good. The first thing it did was change my attitude. When you go from having no hope to realizing that, hey, there's something out there that might help me, it's a big mental boost. And getting your mind behind it and get focused, thinking the right way, that's a very powerful thing when you're healing up from an injury like this.
Yeah, and a lot of people, unfortunately, I can remember a story I have of myself. I had hurt my shoulder when I was thinking this morning for some reason. I don't know why. When I was in my late 20s, I hurt my shoulder. I remember going to a doctor, and the doctor was not in shape. Not that you have to be in shape if you're a doctor. And sitting down with him in the MRI, and he's like, you know what? You just need to quit working out and find another hobby, because you just can't lift weights. I mean, like your shoulders are shot. You should be lifting weights. Like you don't need to lift those heavy weights anyway. That doesn't make you healthy once you start jogging or something. I remember thinking that sucks. Like
yeah, that's.
So you take away someone's hope, and that's nothing compared to your injury. I'm not trying to equate what I had, my little achy shoulder to what you had going on, but a lot of times, people are told by their physicians that it is what it is, or we do a lot of stem cell procedures now on people that have knee pain and hip pain. And these people are told you're eventually going to have to replace your knee. You have to. You're going to have to at some point. And these people come in and we do stem cell and other procedures, and they don't have to replace their knee just because some doctor told you have to do something, or you have no hope, or this is the new normal. That's not always the case, and the body does heal. If you're alive, you heal, right? So if you're alive and you have will, anything is possible.
Yeah, I think that after the first laser treatment, after the very first laser treatment, I think that was the first night that I was able to sleep through the night without waking up in pain. And that's when I realized that, hey, there might be something to this.
Yeah, and the other thing, Bill, when you can't sleep, you don't heal. It's this vicious cycle, you know what I'm saying? And a lot of people that have chronic pain, there's a lot of people that suffer like rotator cuff pain. Every time they roll over, they wake up. Well, if you're not sleeping good, it's going to affect your hormone levels, and it's just a vicious cycle, So, and I know you did some other things too. We also, you're on hormones.
Yep.
Which help out. I mean, once again, in particular, what people don't realize, if you have a lot of pain, it affects your hormones. So anyone who suffers with chronic pain is going to have really low testosterone, growth hormone, and estrogen levels every single time. And the problem with that is those are the very hormones that you need to heal. And another thing that kills hormones is if you're listening to this and you're in chronic pain and you're taking opioids, double whammy. Opioids also destroy your testosterone, estrogen, and growth hormone levels. So these very medications you're taking to mask your pain are limiting your healing. So anyone with chronic pain needs to get their hormones checked out, and really, just because someone told you can't get better, always get a second opinion. And if you can come to Buckeye, we don't charge you for a second opinion. And we obviously we can't help everybody, right? We can't. And I told you right up front, I don't know if I can help you. We'll give it a shot, right?
It's but then again, it's worth a try. If you're feeling hopeless, you're not going to heal.
100%, you're done.
Yeah, it affects everything. The mental side of things affects how your body reacts.
And it's sad. There's a side story. You always hear pill mills, and there's a clinic right in where my main town. I live in, our main office is in Grove City, although we have other locations around town. In Grove City, there's what we'll call it a pill mill. And I drive by there once in a while, and I just see like the cars and the people walking, and their heads are down, and like it's a dead end. And those people have no hope, and they've probably been told they're never going to get better, and this is the new normal, and you're going to take these medications. And I'm not saying that opioids are bad for everyone. There's certain situations, right? But if that's your lifestyle and that's the way you're going to be, you're dead. You just don't know it.
Yeah. One of the first things, I'll tell you right now, the medication issue, there are a lot of side effects. Mm-hmm. They talk about exhaustion, being tired all the time, low blood pressure, being dizzy. This list of side effects goes on and on and on. Mm-hmm. So that was really, having a lot of that was a problem. I've been able to go from 800 milligrams of gabapentin 3 times a day right now down to 100 milligrams twice a day, with the goal of by the end of next week being on 0, completely getting rid of that medication.
And this is something you told me. This is something you're doing on your own.
Yeah, just cutting that down and getting rid of it.
Because like, unfortunately, a lot of people, if their doctors don't tell them not to do it, like common sense and taking care of yourself is something that everyone should have. And unfortunately, a lot of people, if your doctor says you need to take 3 a day, even if you're not really sure, you just do it. At least you have the common sense to know that, hey, listen, I know long term this isn't a good thing. I'm going to do it smart. You didn't do it cold turkey, but you're listening to your body and doing what your body's telling you.
If you can tolerate the pain and you can cut that back, cut it back. And that's what I've been doing, just slowly moving it back, and with the goal of being off of all medications. And when you do that, you get rid of the side effects from that. Mm-hmm. The other thing I'm able to do, because I'm not totally exhausted every day, and I'm allowed to or able to move around a little bit better because of the pain, is I'm able to get back to the gym.
Yeah, I've seen you over the gym.
Yeah, it's been, and again, just mentally, that's a big thing, and physically getting myself back in shape.
Yeah, and everyone has to exercise. I don't care. Like as soon as you quit exercising, it doesn't mean you have to go to the gym, but walk, do something. Like if you don't exercise, stick a fork in you too. With something, and maybe if you have leg pain, do upper body or something like that. You got to keep moving, because as soon as you sit on the couch and throw the towel in, I mean, it just goes downhill from there. It affects your metabolism, affects your endocrine system, and it's a slippery slope. And unfortunately, there's a large percentage of our population that have just thrown the towel in because they think they have no hope. And they get up in the morning, they take the pain medication, and they sit around and watch TV all day long and probably eat foods they shouldn't be eating. And that's not living, man.
No,
that's not living.
Not at all.
So, you're definitely an inspiration, and we appreciate your service. I mean, because you're out there, and your sacrifice keeps us safe.
Thanks, Doc. I appreciate that. It's been great getting in to see you. So I appreciate everything you've been doing.
Yeah. And if you had one piece of advice for people that have no hope, what would you say?
Don't stop. Look for some alternatives. Definitely get a second opinion, and don't give up. Don't give up hope.
Awesome. Thanks so much. I appreciate it. Like I said, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is our website. If you're listening out there and you don't have hope, or you have a condition that maybe someone said couldn't get better, you can always go right to our website, get an appointment. We don't charge you anything to look at you and see if we can help. I can't promise I'll help everyone, but it's not going to cost you anything for a second opinion. So I strongly encourage you to at least pick up your phone, go on the computer, come in and check us out. And if we can help you, we'll shoot you straight. And if not, maybe we know another person that can. So until next time.
All right. Easy, right?